Hello, my name is Ryan Moten, and this is my COMP435 final project. I'll be focusing on the Magellan Health Incorporated data breach. So an introduction to this attack is that Magellan Health Incorporated is a Fortune 500 company. They're a for-profit managed healthcare company focused on special populations and support innovative ways to access better health through technology. Their clients include managed healthcare organizations, employers, labor unions, various military and government agencies, as well as third-party administrators. Company is currently headquartered in Arizona as of 2014 when they moved from Connecticut and employ about 10,500 people. So in April 2020, Magellan discovered a breach in its system that was caused by a social engineering attack that enabled hackers to gain access to the health plan's servers and have access to hundreds of thousands of health records and other personal information from employees and clients. The company was also recently acquired by Cintian Corporation for $2.2 billion in January 2021 after this data breach had already occurred. So motivation for studying this specific attack is that it's a very common type of attack that can affect millions of people at a single time. A data breach attack that is successful through phishing is a large problem for many healthcare and insurance companies because of the sheer amount of personal information they're required to keep in order to accurately perform their jobs. Social engineering attacks are also necessary to study because in most situations, these attacks can be easily avoided with just caution in a workplace's electronic communications. So looking at this diagram, we can see that it shows the number of healthcare data breaches by month from January 2014 to September 2019. And looking at the overall trend in healthcare data breaches, we can see that they have consistently increased during this time period. And according to Leah Toms, between 70 and 90% of all data breaches are due to social engineering. However, that number may be higher. According to Colin Bastable, CEO of Lucy Security, he said that phishing emails are used in over 92% of all data breaches, and healthcare is the #1 target for these attacks. Also, Nayam Muldoon, OneLogin Senior Director of Trust and Security, also stated, as phishing attacks become increasingly common and increasingly sophisticated, companies cannot rely on defending 100% of these attacks. He said the best defense against ransomware is a robust business continuity or disaster recovery plan that incorporates security and privacy requirements and supports reducing the risks associated with these ransomware attacks. So if we look at the attack vector, we can see that it's pretty straightforward. So first, the attacker sent around a phishing email that impersonated Magellan clients to several employees that had an access point to the server. And after one of these employees interacted with that email, most likely clicking a link, the attacker was able to skim that employee's data and use malware to gain access to user login credentials. After obtaining these user login credentials, the attacker deployed software to exfiltrate personal information that included both employees and client information. After the attacker obtained this personal information, they then deployed a ransomware attack on Magellan's system, forcing Magellan to make a decision whether or not they were going to pay the ransom to the attacker. So looking at the consequences of this specific attack, it was initially believed by Magellan Health to only affect a small number of employees in a single location, most likely on a single server. However, on June 12th, after a couple weeks of initial investigation, the Department of Health and Human Services issued a notice that the breach information included names, treatment information, health insurance account information, member IDs, health-related information, email addresses, phone numbers, and physical addresses. And also, in some cases, social security numbers were obtained. Then, as of July 21st, 2020, the total number of impacted individuals had climbed to around 365,000 people, as other entities of Magellan Health reported their cases. So we can look at this diagram and better understand the delay of reporting that occurred within this diagram. So you can see that the first three spots, not only after the social engineering attack had happened, the exfiltration of personal information had happened, and the ransomware attack had already happened, that Magellan was aware that it was a victim of cybercrime. So soon after that, they hired a cybersecurity firm to investigate the attack. After a couple weeks of a preliminary report was released, but as time went on, more Magellan Health units reported data breaches, and the initially perceived 365,000 affected was now believed to be more than 1.7 million individuals, far more from what they originally believed to just be a self-contained attack on a few employees. So, continuing on the consequences of attack, we can see that the fallout of this specific attack was that Magellan Health was obviously the target of the attack. But the secondary harm of this attack is all of that personal information that was made accessible to the attacker, including employees and insurance members of Magellan Health. And that the tertiary harm of this attack is that individuals that are possibly looking for healthcare, or other companies looking for healthcare plans, are probably less likely to choose Magellan Health for fear that their private information may not be secure as it should be from potential future data breaches. And according to Magellan Health, they were working with law enforcement after this attack, including FBI, to prevent future attacks from happening, as they implemented additional security protocols to protect networks, systems, their email environment, and other personal information. Magellan Health also stated that they were able to restore their systems and health records from backup hard drives and claimed that they didn't pay the ransom requested by the attackers. So in conclusion, we can just see that the Magellan Health data breach is just another example of how vulnerable our private information can actually be. Many companies keep our personal information in their databases and servers to have accounts for their users. And in the case of healthcare companies, they hold our personal information for the reasons of having accurate and up-to-date medical records, which is necessary to administer appropriate care to clients. This data breach, like many others, started with a corrupt email that ultimately gave the attacker the necessary resources to gain access to Magellan servers and to deploy further corrupting software to companies' systems. In this attack, the amount of personal information that was originally reported was much less than what was actually found to be exposed in the attack. And so in cases like these, yes, you can pay pay the ransom and get your servers back. But companies can apologize to clients for the breach and offer identity protection plans. But in reality, the client's information has already been compromised and attackers may have already sold their data elsewhere on the internet. So 2 questions I'd like to ask the class is that the first one being, what can be done by users to help prevent phishing attacks from being successful? And the second one being, as a customer, how likely are you to find an alternative option when purchasing products if the company you're originally looking at has a known recent data breach? And here's my works cited, and thank you very much for listening.